Thank you all for joining me, those of you who are in the room so far. I know folks are busy, but we're going to go ahead and start now, actually. Okay, so welcome everyone to Conversations with Dr. D. My name is Dania Dunkley. I've been a registered nurse for about 16 years now, and my primary area of focus has been in maternal child health. And so I just wanted to discuss a topic that's near and dear to my heart, which is moms and babies. And during this really stressful time with the pandemic, I know many parents, expectant parents, or recently delivered parents may have some questions, concerns. So this is my way of providing some free information for that population, or for those of you who may know someone and would like to share the information with them. So I don't want to belabor the moment. I've prepared just a brief presentation to kind of help us move the conversation along. And so I'm getting ready to share my screen. At any point, if anyone has any questions, if you're in the Zoom room, I am able to see your questions in the chat. So please type it in so you don't forget what you wanted to ask. And we're gonna go ahead and get started. I'm gonna go ahead and share my screen with you. Okay. And let's get this on the slideshow. Alrighty, here we go. Okay, so today is going to be a general presentation discussion on pregnancy and childbirth. I'm going to have future sessions in which we discuss other topics, but this will be a broad overview of a few different things that you may need to know if you are pregnant or expecting during this time. And so I've already introduced myself. Why am I doing this? Because I know that people have fears. I know people have questions. They're not sure how the pandemic or COVID-19 will affect their pregnancy or their childbirthing experience. And I just wanted to give a brief disclaimer that I am a registered nurse. I am not a physician. It's Dr. D because I have a PhD, a doctorate in philosophy. I am not a medical doctor. And so anything I share with you here today is for informational purposes only, and you should consult your physician or your healthcare provider, whether that's a midwife or your OBGYN, whomever you see for your medical care, in order to discuss any options or questions that you might have after today. It is in no means intended to replace their advice or their recommendations for your care. So today we're going to discuss what is COVID-19, how do you protect yourself and your family, will it affect your pregnancy and your baby, and in what ways, and what you should expect during the prenatal period, during the labor and birth process, and once you've delivered. Also, we're going to discuss what happens if you are positively diagnosed with COVID during a pregnancy or shortly after the delivery. So just a little bit of a background. What exactly is a virus? It's a microscopic infectious agent, and viruses need a living organism to be able to survive. So that means us. We are the host, right? So it needs to attach itself to a living organism in order for it to survive and replicate. Human coronaviruses, which is a group of viruses known as the coronavirus, have existed even before the pandemic. And so we've always known that they existed. However, excuse me, let me go back for you. Um, this particular virus is new, right? So it's new and it got a new name. So COVID-19 is a type of coronavirus. And the way that the name came about is the CO for corona, the VI for virus, and the D for disease. So COVID and the year 19, because it started to be discovered in 2019, this type of particular virus. And so it's called a novel coronavirus because it's new. They've never seen this type of coronavirus in humans before. So that just gives you a little bit of a background on what it is that we're dealing with and where the name came from. Because some people are using coronavirus, some people are using COVID-19. They are one and the same. Coronavirus is the umbrella. COVID-19 is the type of virus. Just like we have different types of flu viruses, right? They're influenza, but there are different strains of it. Okay, so COVID-19 is just one type. So some of the common symptoms, some of this is a review for all of you, I'm sure, that you've heard these symptoms before, recommendations from the CDC and all the news. You may have symptoms, right? So these symptoms typically appear about 2 to 14 days after you've been exposed. Those include what you see here, like coughing, shortness of breath, fever, and all the others, muscle pain, new loss of taste or smell was recently added on as a common symptom. And just want to stop here and say that this is not a complete list of all the symptoms that you might experience. And as we get to know the virus a little bit more, things start to get added on. So it's still evolving. We're still learning. There's still research going on. So that is why you hear sometimes, okay, well, this was a symptom. Okay, now we've added on another symptom, because they really don't know everything about the virus. So these are some of the things that you should seek medical care for immediately if you experience any of these. Trouble breathing, right? Pain or pressure in the chest. If you are suddenly just confused, you're disoriented, if you're unable to wake up and stay awake, if you're constantly falling asleep, bluish lips or face, that means that you're not getting enough oxygen to your body. And so the oxygenation in your body, you start to turn into this bluish hue in the lips or the face. So you should call your medical provider for any other symptoms that you might be concerned about. Call 911. And another tip is to call ahead to the facility where you're going to be treated, just to verify some of the symptoms that you might be experiencing, and save yourself a trip if it's not necessary. But by all means, if you feel that it is life-threatening, you should definitely seek emergency care. How do you protect yourself and your family, right? So with coronavirus, it is spread mostly through contact from person to person via the little droplets, okay, in their sputum or in their nasal secretions if they cough or sneeze. So I'm sorry, I'm adding people as they come into the room. If I seem a little distracted, that's what I'm doing. Welcome to those who just joined in. So if it's spread mostly by person-to-person contact, then we should definitely adhere to the social distancing guidelines, making sure that we stay at least 6 feet away from people. But the major thing in order to prevent this spread is staying inside, sheltering in place, right? So that's why I put that as the first bullet. Stay home, folks. All right, this is very serious, and staying away from infected persons is your best way to prevent contracting the virus. Now, you might say, well, this person looks completely healthy. But infected people may not show symptoms at all. Okay, some of us have had the virus and don't even know we had it. Okay, not everyone that contracts the virus shows symptoms, right? So no visitors. And sheltering in place means that you are living in a space with people who have already lived with you. This is not the time now to move somebody else in. It's not the time to have small gatherings and parties because you think that your loved ones, don't exhibit any symptoms and you trust them. You love them, but it's best if the people who were already in your household are the people that that you interact with. You should also, if you go outside, make sure that you're covering your face. Now, before, as I said, knowledge is constantly evolving, right? So before it was, you didn't have to wear the mask, but now the recommendation is definitely if you're going to venture outside or if you're going to be around other people, that you wear a face mask. Washing your hands. All right. The other way to spread the virus is to touch an infected surface or object, and then touching your own face, mouth, eyes, nose. Okay, those are your main entry points for the virus. So make sure you're washing your hands. If you don't have soap and water right where you are, please carry around some hand sanitizer. Hand sanitizer is a word my godson uses. A combination of hand and sanitizer. So carry your hand sanitizer around with you. Make sure it's at least 60% alcohol, and make sure that you are constantly cleaning surfaces that you touch around your household. Now, what are some of the things if you're pregnant? What can you do? Because this time it makes us feel like we're prisoners kind of in our own homes at times. But there are some things that you can do that are still healthy, and you can modify them a little bit to make sure that you're not exposed. Now, it is recommended that you do get some fresh air. Go outside, walk around the block, go to a park, but make sure you keep your distance from people, okay? And wear your face covering, maintain your 6 feet or more apart. Exercise. It is healthy for pregnant women to get some exercise. Now, I'm not telling you to begin a high intensity, what's the P90 or whatever it's called at this point, once you become pregnant. The intensity of your workouts depends on how active you were before you became pregnant. So if you were an avid runner before you became pregnant, you are perfectly okay to run while you're pregnant with your doctor's clearance, obviously, but you don't want to start a new kind of intense regime once you become pregnant unless your body is already acclimated to it. Now, prepare your own meals, okay? And I'm sick of doing it just as much as anybody else at this point. Sometimes we like to eat out, but during your pregnancy, it's always safest, especially during with the threat of COVID-19 and the risk of exposure, to prepare your own food, okay? Maintaining connections. We need people. We need relationships. We need that interaction, all right? We're supposed to socially distance, but we don't need to be isolated. And definitely when you're pregnant, you need that sense of social support, especially if you're alone in your household. Everyone doesn't have other people living with them while they're pregnant. So if you, and even if you do, keep in contact with your family and all of those sources of support that you would normally interact with digitally. FaceTime, Zoom. I know I'm zoomed out sometimes, but it is a way of making sure that we stay connected, and it's good for your mental health. Skip the slide there, sorry. Don't overdo it, okay? If you have people in the house that can help you, reassign some things, all right? Preserve your energy. Yes, you should do some moderate exercise, just to keep your blood flowing and keep your body healthy, but don't overstress yourself. Slow down a little bit every now and then and reassign some of those chores and errands. Get sleep. Your body needs sleep, okay? Even if you're not pregnant, your body needs sleep, and a good amount of it on a regular basis. 7 hours average, 7 to 8 hours is what is recommended for a good night's sleep. Do the things that you like. Do things that relax you, right? Read a book, listen to some music, dance around the house a little bit if you have to. But, there are things that you can do when you're sheltering in place that are healthy and that won't put you at any risk during your pregnancy. So let's get into the nitty-gritty of how this really affects your pregnancy, right? So your body, when you're pregnant, goes through some normal changes. Changes to your immune system, changes in your hormones that might make you more susceptible to infections, right? And also viruses. So, these are even without the threat of COVID, your pregnancy puts you at that risk. Now, these are normal changes, right? Sometimes your level of immunity is increased, sometimes it's decreased throughout different points of your pregnancy. And that's all designed by nature in order to protect you and your baby from any disease. So that's something that you shouldn't fear. It's a normal change. It's an expected change. But knowing this, you need to make sure that you take proper precautions. Now, based on the available information that's there and the studies that are available, although limited, pregnancy doesn't seem to pose an increased risk for COVID-19 than people who are not pregnant. Okay, so that's where we are now. As I said, knowing that you are a little bit more susceptible to infections, you want to make sure you take those proper precautions that we talked about before. Also, pregnant people or pregnant patients with other diseases or other disorders, that's what we call comorbidity. So if you're pregnant and you have high blood pressure, pre-existing or gestational, or if you had heart disease before or developed it recently, or if you were diabetic, those are what we call comorbidities. So it's in addition to your pregnancy. That might put you at increased risk for more severe illness if you are affected by the COVID-19 virus. Okay, how does it affect your fetus? So when we say fetus, I mean in utero before the delivery. So from what the information that's available right now, it's not likely that you will pass if you are infected with COVID-19, it's not likely that you will pass it to the fetus, okay? During the pregnancy, during labor, or shortly after delivery. However, like I said, studies are still coming out and information is limited at this point. So what we do know is right now there's been no evidence of COVID-19 in amniotic fluid, which is the fluid that's surrounding your baby inside of the uterus and inside the amniotic sac. And there's been no COVID-19 found in the cord blood or the umbilical cord. Okay, there are some blood vessels in there that help transport nutrients and oxygenation and everything through to your baby. The blood that's in that cord, there's been no evidence of COVID-19. Now, there have been a few reported problems in other countries that have studied this, especially China, since they were the first and probably have the most information on the virus, that preterm births have been reported, which means that you deliver before a full 37 weeks. And so, but it was unclear whether or not it was related to COVID-19. So still a lot of unanswered questions, but we do know right now from the research that's available that it has not been passed in utero. Okay, how does the baby, how is the baby affected? So infants that are born to women that are COVID-19 positive are generally well. Okay, however, there is a risk for spreading the virus to a newborn shortly after the delivery, because now they're now in our environment where the risk of exposure becomes a little bit more real. So actually, in essence, they're a little bit safer inside than they are outside. But so it might be spread from person to person after the delivery, but babies and children don't seem to succumb to the COVID-19 virus as adults have. However, if they do contract the virus, infants are a little bit more at risk for developing severe illness with COVID-19 because their little immune systems are immature, and they also have smaller physical structures like their airways, right? So they're a little bit more susceptible or at risk for developing respiratory issues. Okay, so with that being said, and with new information always coming out, there is now a concern for infants and children that they've termed pediatric multisystem inflammatory syndrome, which is a mouthful, but they're not quite sure what it is yet. Right now, they've seen kids and infants presenting to the emergency room with symptoms that kind of look like a disorder called Kawasaki disease or Kawasaki syndrome. And some of the symptoms are exactly like it, which are like fever, the red eyes, rash. Some kids are also having some abdominal pain and vomiting and diarrhea. And so I put this here because it is new information. And if you have recently had a baby and notice any of these symptoms, you should certainly bring it to the attention of your pediatrician. So what should you expect during your prenatal care or during your prenatal process? There are going to be some changes, all right? It's, unfortunately, for many women who are expecting, this has really interrupted the way that you may have envisioned your pregnancy experience, your labor and birthing experience. And, it's a little scary. It's a little upsetting, and that's valid. It's okay to feel that way. Because, you had an idea of how things would go, and now this has been completely interrupted. And so one of the major changes would be to your prenatal visits. The schedule might be altered, all right, to reduce the risk of exposure to yourself and your significant other if they accompany to your appointments, and the other women that are also being seen, and also to the staff, the healthcare staff. So, as much as they've changed all the regulations, really and truly, the bottom line is that they're trying to make sure that people remain safe on both ends, on the provider end and on the patient end. And so an example of what might happen is they'll reduce the in-person visits. And one of the examples, this was from the University of Michigan. They may do certain visits in person, and then the others might be done by telehealth, which we'll talk about in a moment. And they might also limit the availability of different appointment times so that all the women that might be seen by that provider or by that clinic are spaced out a little bit more. So you might not get your choice appointment because they're trying to limit the amount of people in the waiting rooms in these offices if they are continuing to have in-person visits. Your provider may also limit the amount of people that can join you, or put a restriction and say, I know of a colleague who, was upset because her husband or her significant other wasn't able to join her for the ultrasound, which these are things that people look forward to, and it should be a normal part of your prenatal process. And it can be very upsetting when the option is taken away. But I want to be upfront with you to let you know what you should expect during this time. Telehealth visits are on the rise for sure. It's an option that before this pandemic may have been offered here and there. Obviously the technology is there, but it hadn't really been utilized. And now we're really having to rely on telehealth. And so they may do the more routine visits or the more routine components of your visits via telehealth. And some of those things could include giving you kits like a blood pressure kit or a blood sugar kit, a scale, a Doppler, so you can take the baby's heart rate, all at home while you're interacting, much like we are right now. There are things that you can do, because it can be concerning. Like, well, if I'm not seeing my provider in person, as often as I would have, what if some of the things that I would have reported are missed? You start to kind of panic, like, is this safe? But there are some things that you can do at home to, stay empowered and stay attuned with what's going on with your baby. One of the major things that you can do as a mom is to monitor how much your baby is moving, right? So monitoring fetal movement at home, right? So the first few flutters, you start to feel those around 16 to 18 weeks. After that, baby really starts to move and kick around throughout the day. And you start to notice patterns because babies do sleep, right? So you start to notice their little sleep and wake patterns throughout the day. What you do want to do is make sure that you feel movement throughout the day, that it's not decreasing, and that you're feeling some movement. No movement is no good, okay? Or decreased movement might be a cause for concern. So during your last trimester, your doctor may or may not, you can do this on your own, ask you to do what they call kick counts, right? So it is just as it sounds. You're counting the kicks. There is no specific number. Generally speaking, within 1 hour or so, you should feel about 10 kicks. Okay, that is not a prescribed number. Please don't panic if you only felt 9 or 8 in 1 hour. It's okay. The idea is that you're sitting in one place in the same spot, same times of the day, and just become in tune with your body and feel for those movements. All right, like I said, if you're not feeling any movement at all, or if you're noticing a decrease in the amount of times that your baby is moving throughout the day, then you should definitely report that immediately to your provider. Other things that you can do are to definitely advocate for yourself. This includes if you're early on enough in your pregnancy where you're looking for a provider, make sure that you screen them well. All right, this is going to be, if you don't already have a provider, an OBGYN that you trust and know and respect, and you're looking for a new provider, it's going to be an intimate relationship, right? This should be a partnership. It should be somebody you trust. It should be someone you feel confident going to. It should be someone you entrust your care to and your pregnancy to. There are websites and there are resources available for you to look at the outcomes of your provider or the facility. You may not be able to have your choice in provider if you're going to maybe a clinic setting where there's multiple providers, but you certainly can look and see what their outcomes are in terms of the types of deliveries that they do, the number of C-sections they do, the number of different adverse outcomes that they have. The information is public knowledge. And sometimes people just kind of take what you're given. You have options, you have choice, you are empowered. This is your body, your pregnancy, and you want to make sure that the person who's caring for you, is a reliable and reputable person. So do your research, do screen your providers or the facility where you're going to be delivering. Ask questions. You know, sometimes we tend to clam up. We don't want to make it look like we don't know what we're talking about, or, you know, people think, oh, that's a silly question. No question is silly. Anything that you need to know, your provider should be able to take the time out and answer the question, and answer it in a way that you understand the answer. Okay, so the medical jargon, you know, for me, I might be able to piece it together as a nurse. But if you don't understand what the doctor said because he's using or she's using these medical terms, please ask. Please stop them and ask them to break it down to you in a way that you can understand. Repeat it back to them. That's a good way to make sure that what you heard is what they intended, and that the communication chain isn't broken, because sometimes, you know, what they've said and what you've heard and processed is two different things. Report any concerns that you have right away. You know, don't hold on to things in between your visits. You know, you should be able to either call and leave a message or call and speak to someone in real time. And if all else fails, you know, make sure that you present yourself to an emergency room if you think it's that concerning. Get other opinions. Okay, if you are not in agreement with a treatment or recommendation from your provider, get another opinion. You are not locked into one provider. If you choose, you know, to change providers, that is certainly your choice. Just make sure that all of your documents and records are handed over to the new person so that they know your history and, you know, can give you the appropriate level of care. Okay, we still got some folks joining in. Welcome. I'll keep going. Remember, you can always type a question. If you think of something during the presentation that you want to ask me, please put it in the chat so you don't forget. And there will be a time for questions and answers after. Okay, so this, we talked about how your prenatal visit schedule might change. And so this is just an example from the Kaiser Family Foundation on what it would look like with an altered visit schedule. So the blue line is how it would have been without the pandemic and without all these changes. The traditional schedule of appointments that go by how many weeks gestation or how many weeks pregnant you are. So as you can see, they're quite frequent throughout the pregnant, and they're nicely spaced throughout your first, second, and third trimester, right? With telemedicine, some in-person visits might be swapped out for a telemedicine visit. And so, for example, here you see the little computer for week 16 would be swapped out, and so on. All right, so the hand means in-person, the little computer means telemedicine. This is just an example. This may or may not be what your provider recommends or what actually happens for you. Different providers, different facilities will have a different process. All right, so when I say ask questions and you're doing your screening, if you're early on in your pregnancy, you don't have a provider yet, ask them, what can I expect? You know, what's my visit schedule going to be like? Is it going to be telehealth? Are we going to be in person? How many of them will be in person versus telehealth? So these are things that you would need to ask when you're doing your screening. Okay, so some of the things that could be delivered or could be done by telemedicine are the things that are on this particular slide. So like I mentioned, they may give you supplies so that you can take your own blood pressure. You can weigh yourself. You can use the Doppler to hear the baby's heart rate. All right, let me admit this person here. You can have a consultation with a specialist, right? So if you have a high-risk pregnancy, they might bring in what's called a maternal fetal medicine, or MFM, or a genetic counselor if they have a concern. And so some of your interaction with those specialists might be done via telemedicine. as well as some of the other services, lactation support or breastfeeding support. There's a lot of things that can be done, although not necessarily ideal or what we're traditionally used to, because some of these things, you know, are going to remain in effect. I do believe that some of our current traditions are going to be interrupted once the pandemic, even after it lifts, in order to make things more efficient, you know, so some of these things can be done from home, quite frankly, you know, to save yourself a trip. But just to let you know what can be expected. So what should you expect during the labor process, right? And we have a beautiful mom here who's in labor in this picture. So staff, definitely once you go into the hospital, if you are in labor, once you get to the triage area, they're going to be asking you some questions. Okay, they're going to probably screen you to make sure that, you know, to determine what your level or risk of exposure has been up until this point, or to make sure that you don't have any symptoms that would make you a person, what they call a person under investigation, or PUI, right? So if they're not sure, right, they're going to certainly test you. But until they have a confirmed diagnosis, then you're a person under investigation. So they need to ask you these screening questions. Unfortunately, and this has been my biggest heartache, is the limit in visitors. So at this point, most facilities have gone to the rule where they've pared it down to just one person, one support person. So what this means is that you can select whomever you'd like to be at the bedside with you. It's your choice. But that means that if you, for example, wanted a doula along with your support person of choice, you're going to have to make a difficult decision on who will be at the bedside if they've limited it to one person. So it's really a protective measure, but again, interrupting the process that you may have envisioned for yourself during your birthing experience. At one point, some hospitals had limited it to 0 visitors. I'm sorry, I need to turn the ringer off. I thought I was saving myself by putting it on airplane mode, but some things are still coming through. They had reduced it to 0 visitors, but obviously that is not in the best interest of a pregnant person. You need support. Nurses, you know, as wonderful as we are, I'm an OB nurse myself. I've been there. We cannot be at the bedside 24 hours, right? You need someone at the bedside with you, who you know, who you trust, who you feel comfortable with. And taking that away just seemed really harsh, even given the circumstances. So most places now have relaxed a little bit, and they're allowing one person. Now, this one person will most likely not be able to leave once they have entered, right? Once they're there, they must stay there. So make sure that you're aware of that and that you pack accordingly for the both of you to remain in the hospital, all right? Because once the person leaves, they're trying to reduce the spread, right? So there won't be any in and out of visitation. Make sure that, you know, your car seat and everything is there with you, because you're going to need that for discharge. Lots to think about there in terms of the limitations with support persons and visitation. Staff during the birth and delivery process wear what we call personal protective equipment anyway, right? Gloves. Sometimes you'll see a mask with a splash guard, because there are body fluids that can splash and get on a provider. But in these times, that might be a little bit increased. because of, obviously, because they're trying to reduce the risk of the spread of COVID. So you might notice that even in your general interactions, especially if you're a person under investigation, as we talked about, they may have the mask on, even in a regular conversation where there aren't necessarily any blood or body fluid splashes happening at the time. So don't be offended or nervous that something is wrong. They're just trying to make sure that the staff stays protected as well. Your support person will be asked probably to wear PPE as well. Okay, so again, this is our new normal. So please, don't be offended. These are just precautions that must be taken to make sure everybody is safe. And remember, the mask is to protect, not so much to protect you from others, but to protect others from you. Okay, so keep that in mind. Okay, now, what about after you deliver? Okay, and again, some tough choices had to be made because of what we're dealing with. It is possible that, especially if you're a person under investigation or if you have a positive diagnosis of COVID-19, that they may separate mom and baby. For how long, it all will depend on, how mom is doing and how severe her illness is, and the length of time that it takes for her to rid her body of the virus. I can't give a prescribed amount of time on how long the separation will be. It varies from person to person. So another thing that is happening is a potential for an early discharge, right? So, which, some people might consider good. Some people might be a little nervous about. Both reactions are fine. But what this means is typically for a vaginal delivery, you're in the hospital for about 48 hours, right? 2 days. And for a cesarean section, it's 36. It's 3 days. So you are looking at possibly being discharged for vaginal delivery as early as 24 hours. As long as the team, the OB/GYN and the pediatrician agree, because now there are two people involved here. We have to make sure that mom and baby are healthy enough to be discharged if they're going to send both of you home in 24 hours. So this, and also for a C-section, it could be as early as 2 days instead of 3. So with that being said, there are things that we monitor while you're in the hospital to make sure that you're stable. Having a baby is a perfectly natural part of our human experience, but things can, go wrong, and you lose blood, you lose body fluids. There's a risk for infection, there's a risk for bleeding, there's a risk for clotting, and we'll talk about what some of those warning signs are in a moment. But being discharged early means that there are now less eyes on you earlier than would have been prior to all these changes. So we've got to teach you really well what to look for when you go home. Okay, and we'll talk about that in a second. So you continue to breastfeed. Okay, right now there are no indications that there is an issue or that it's passed through breast milk, so you should continue to breastfeed. Or even if your baby is separated from you, you can still express your milk, and we'll have a session on breastfeeding and all the mechanics and everything that go into breastfeeding later on at another date. But you should express or pump your milk and bottle it even if you're separated from your baby, so that the baby can still get the milk. They just won't be able to latch at the breast. And make sure you have a plan in advance for how you're getting home, transportation, the car seat, as I mentioned. And then once you get home, what's the process going to be once you get through the door, right? So now, as many of you know, when you go out and do your grocery run, there's a process that you follow when you get back home to make sure that you don't now contaminate your home, whether that's removing your clothing at the door or in the garage or wherever. You're going to have to think about how you're going to do that process when you get home, with now the addition of your new baby, right? To prevent that cross-contamination. Just something to consider. So the warning signs. These are things that you want to look for when you get home, and they should be reported immediately, or you should report to your emergency room immediately, or call 911, depending on what it is. And so this is a nice, easy way to kind of remember it. Post-birth, we call these mnemonics. So each letter stands for something. So post, pain in the chest, all right, or chest pain. Obstructed breathing or shortness of breath. So if you're having trouble breathing or catching your breath. Seizures. Okay, seizures can be a complication of preeclampsia, or at that point, if you're having a seizure, it is now eclampsia. But definitely call 911 for any seizure activity. Thoughts of hurting yourself or someone else. All right, so any suicidal or thoughts of endangering yourself or someone else, please seek help or attention from a provider. The next word is birth. So the B is for bleeding. All right, so huge risk of for pregnant women, for postpartum women, is the risk for hemorrhage, or what you've probably heard is postpartum hemorrhage. It's basically bleeding, excessive bleeding. So if you're soaking through one pad an hour, or you have large clots, all right, that is definitely a sign that you could possibly be hemorrhaging, and you want to call your provider or get help right away. And incision. So if you've had a cesarean section and your incision is not healing, or if it opens up, we call that a wound dehiscence. If it opens up, if it's oozing, if it's red, if it's swollen, if it has a foul odor from the discharge, or if it has excessive discharge, make sure that you report it to your doctor. Pus or anything like that. So that's the incision. Also, if you've had an episiotomy, which means they had to cut you, or if you had a laceration, meaning that you tore during the delivery. I keep looking at myself, but I got to remember the camera's up here. The incision, the episiotomy site or the laceration site, also that does apply to that incision. All right, so you may not have had a C-section, but you may have had a tear, or you may have had an episiotomy. So those same things apply. If you have redness or swelling in your legs, now being pregnant, right? I didn't say this earlier, but when you're pregnant, some of the clotting factors in your blood change, and it makes you more susceptible for developing clots. And that's why it's also important to get up, move around, have some activity while you're pregnant, and also right after you deliver, that risk is also increased. So you don't want to lay around too much in one position. Move as much as possible. If you've had a C-section, it might be a little difficult, but certainly, take some laps around that hospital room, or even around your house. Just walk around, stretch. All right, so redness or swelling in your leg that's painful or warm to the touch. Okay, could be a warning sign that you might be developing a clot. Temperature. All right, so temperature or fever usually indicates your body is trying to fight something off. So it might be a impending sign of infection. A headache that doesn't get better, even with medication. Okay, so that might be issues with your blood pressure. So those are some of the the major warning signs that you want to look out for. And as I said, if you're going to be, now that they're going to be discharging people a little bit earlier, you really want to make sure that you have eyes on these things, because now you don't have all these nurses and doctors around you for the 2 or 3 days that you usually would have stayed. Okay, so the big question: what happens if you are diagnosed with COVID-19 at some point during your pregnancy or right after delivery? You find out the news. Now, you certainly want to follow the advice of your doctor. Remember, that is a partnership, and you want to make sure that you and your doctor are on the same page on what to do. Now, the guidelines from the CDC about washing your hands, about cleaning your surfaces and wearing the mask and the social distancing remain the same. However, if you're discharged home, right, if you're well enough to be discharged home, because sometimes they discharge you before you are completely cleared or free of the virus, then you're going to have to figure out a way of separating yourself from the other people in your home. And as you'll see on the next slide, that also includes the baby. Now, you're asking yourself, I'm a new mom, how am I going to separate myself from my baby? Unfortunately, that is what's recommended. And we'll get to it in the next slide. I'll talk a little bit more about how. Monitoring your symptoms, okay? So making sure that those same symptoms we talked about at the beginning, that you're not experiencing any of those, or you're not going backwards, that you're starting to feel a little bit better. So make sure that you talk to your doctor or seek emergency care if you're starting to feel worse once you get home. Now, for the baby, all right? Again, like I said, it's recommended that you distance yourself from other people in your home, but you may also end up having to distance yourself from the baby. So if at all possible, have your support person be the main person who's going to do all the newborn care, at least until your symptoms have subsided and you meet the criteria for someone who is now COVID-free. So if you absolutely cannot avoid it and you need to be in close proximity and you're the only one available to care for the baby, then make sure you really adhere to the hand washing, frequent hand washing, wearing the mask, and everything, and pumping your milk instead of having the baby latch. If you express or pump the milk and you bottle it, make sure that the exterior surfaces of the bottle are cleansed before you give the milk to the baby. Just take every precaution that you can, as you would if you were feeding yourself, and you suspected that you could potentially be contaminated. The same thing that you would do for the baby. So make sure that you're sanitizing their care items, their clothing, their bottles, any surfaces that you use to care for your babies. Make sure that you're sanitizing them frequently, which you would have been doing anyway, because as I mentioned, newborn babies, their immune systems are immature, and they can't readily fight off infections as well as we can. So you're not just protecting them from COVID, you're protecting them from all the other things that they might be susceptible to, even in the absence of COVID. Now, so the criteria, according to the American Academy of Pediatrics, is that once you're afebrile for 72 hours and at least 7 days have passed since you first experienced your symptoms, then you should be able to go ahead and resume normal care of your baby. And that, my friends, kind of concludes our presentation. But I do want to make sure that we have time to pause and see if anybody has any questions. I'm going to also check in on Facebook. I see one question. I'm gonna answer that in 1 second. Okay, so the question is, how would scheduling change if the person has a high risk pregnancy? That would have to be determined by one, what the risk is. So is it that the person, because the term high risk pregnancy can apply to a number of things. It could be advanced maternal age. It could be you're having a multiple gestation, meaning twins or triplets or something like that. You have some kind of hypertensive disorder, you're diabetic, you had some kind of pre-existing heart condition. It all depends on your diagnosis, what it is that makes this pregnancy high risk. And it also depends on what's going on with your body. There's no set in stone way to determine what the schedule would be. It would all be customized based on what's going on with your body, how your pregnancy is progressing. And again, like I said, they would probably pull in a maternal fetal medicine specialist or genetic counselor at some point to consult, as well as sometimes they might consult with a neonatologist. That's the specialty that deals with the high risk newborn. Even in utero, they might bring that person in to consult and see what the plan will be for your particular pregnancy. There are no one size fits all. There are recommendations and guidelines, but the way that your visit schedule will look will likely be different from someone else's. So that's the best answer that I can give to that question. But it will likely still be some combination of in-person and televisits, unless your particular provider at this point is still doing all in-person visits. Any other questions at this point? I'm going to also check in on our Facebook. Okay. Okay, well, right now I'm not seeing any questions other than that one. Oh, someone's typing something. It's not complete yet, so I'll wait. It says, can you? Okay. Oh, there's more stuff. All right, hang on. Let me blow this up so I can see all your questions. Okay. Can you provide some information about Tdap vaccine? So it's recommended that all the vaccinations that you would normally get, whether it's for flu or Tdap, for those of you who are like, what is Tdap? Tdap is a combination vaccine for tetanus, diphtheria, and pertussis, which are common childhood illnesses that have now been kind of eradicated for the most part because we have such a robust immunization schedule. So now it's recommended for women to get the Tdap vaccine and their caregivers, any caregivers that are going to be closely taking care of the baby, to also get the vaccine. So yes, it's okay to still go ahead and get vaccinated even during this time with the concern of COVID-19. Also, someone asked, have they determined that the virus doesn't pass through breast milk because we are still encouraging exclusive breast milk? That's correct. At this time, there is no evidence that it is in breast milk or passed through breast milk. So to answer that question. Yes, you should continue breastfeeding. Do you believe the pandemic caused many women to give birth before their scheduled time? Anxiety, perhaps? Well, funny because I've been researching a little bit on perinatal depression, and it turns out that stress and anxiety are or I should say mood disorders or anxiety disorders, tend to be a little bit more increased during pregnancy. Even, let's take COVID out of the picture. There are just certain things that happen in the brain while you're pregnant that might put you at higher risk for developing anxiety and mood disorders. So that is a very real concern, even without the onset of the pandemic. Now, with the added stress of that, I'm certain that there are added compounding issues. Can I say for certain that that because of COVID, that's what's causing the preterm birth because of the stress? No. The information that I've seen with preterm delivery, they were inconclusive in terms of was it specifically related to COVID-19 or stress, or so it's hard to give a definite answer of whether or not that's the cause. We do know that stress is a factor sometimes in preterm births. It might not be the sole cause, but it is a risk factor. So that's the best answer I can give you without being too prescriptive. Okay. Most in-person Lamaze courses have been canceled during this time. Do you have any resources for online courses or free videos? Actually, I do believe even if you go on lamaze.org, or I'll give you a couple of resources that I use. Lamaze.org, A1.org, I'm sorry, A1, is it .org or .com? Sorry. But A1 is the Association for Women's Health, Obstetric and Neonatal Nurses. And they sometimes have patient resources that you can use for like classes. There's latched.com, latched.com. And there are a number of other independent groups out there and organizations that have now realized we can no longer do the in-person route. And so they're offering virtual classes, if that answers your question. You're welcome. Okay. So, let me see. Let me go back and see what's going on Facebook here. Does anybody else have any other questions? Okay. Well, I thank you guys for your time, for your attention. Just so you know, in the next couple of weeks, we'll have more sessions. Next week's session, actually, I'll have some guests, so it won't just be me talking to you or talking at you. We'll have two parents, a father and a recent mom who both recently delivered, and they'll be sharing their experiences with you. It'll be kind of like a question and answer session, so that you can hear real, actual experiences from the parent perspective, and you can ask them your burning questions. We'll also have a doula the following week, who will kind of give us an overview on what the role of a doula is and how they can help support the labor and birth process. And then the final week of the month, we will have a lactation consultant who will answer questions all about the mechanics of breastfeeding, the anatomy, techniques, and what we know so far about how it affects, how COVID-19 affects breastfeeding. So stay tuned. I will definitely post those upcoming dates shortly. So you have all the information that you need to join me the next few sessions. Thanks again, and I hope this was helpful. I did record, and more information to come on where it will be posted, or where the information will be stored, so that you can watch it at another date or a later time. Thanks again, and enjoy your day. Please encourage some of your other friends or anyone else that you might know that is expecting to follow me on social media at I am Dr. D, IAMDOCTORD, or on Facebook. You can search my name, DAIHNIADUNKLEY. I'm also on LinkedIn under that same name. All right, stay in touch. Let me know if you have any questions, and you can also email me at I am Dr. D and the number 1 at gmail.com. Okay. Have a great day, everybody.